I'm Dr. Gregory Burek. I'm the medical director of the BRAVE program with Medical College of Wisconsin. It stands for Building Resilience Through Action in Veterans and First Responders. I'm a Marine Corps veteran myself. I was in 1999, 2003. I was a sergeant and I deployed in '03 for the invasion of Iraq. A lot of veterans, first responders, don't know that this treatment is available to them. They may also not even realize the symptoms that they may be having. So it's really important to normalize and destigmatize a lot of the stuff that they've been through.
I'm Adam Plotkin. I'm a fourth-year medical student, and I am currently a second lieutenant in the United States Army. Soon I'll enter residency as a captain and do my residency at a military training facility.
My name is Jeffrey Rodriguez. I was born and raised in Los Angeles, California. I'm a fourth-year medical student. Plan is to go into anesthesiology within the Army. My military service started back in 2013. I enlisted as a medical lab technician, and I served for 6 years. A lot of military members, they get out of the military, and they already feel some type of aversion towards medical professionals because they feel like they're going to be taken away from the team. When I came here, I was like, I need to help break these barriers.
Military in itself is its own culture. We have our own language, our own experiences, our own values. Some of those experiences are like getting a TBI or a traumatic brain injury. It's pretty much a part of the job. You try and just shake it off and kind of get back onto the mission.
You know, I was fortunate enough to get to do my third-year psychiatry rotation here, so I had 4 weeks of learning all about the BRAVE program and seeing the great work that everyone does here, and learn a little bit more about some of the moral and the mental injuries.
There's a lot of misconceptions or stereotypes about the military. Every veteran's journey is kind of unique.
Yeah, so the Run the 50 miler kind of came as a request from my buddy Adam. A year prior to that, I had asked him to do a 30 miler with me, and of course he was the only one that was not smart enough to say no, and so naturally when this 100 miler was coming up, I was the person that came to ask.
I think there's beauty in running these super long races, because when you're out there, you know, it's just you and yourself. It's your mind and your body versus the road. Most people don't truly ever get to the level where they actually understand what they're capable of. It was never about the running. I picked it because I wanted to find solace in the suffering. You know, the mind will tell you to quit. The body can keep going. It was 100 miles in order to draw attention to the BRAVE program, right? That was the end goal of all this.
Around mile 40, when I was at a mileage that I had never been at, and I knew that I had about 10 miles to go, it's one of those things in your mind where, truth be told, I woke up that morning, no question in my mind that the mileage was gonna get done. I'm able to do things that so many people who pay the ultimate sacrifice don't get to do. I woke up this morning. I had the choice to be out here today to make something meaningful.
No one's here, they won't know I quit, right? But when I set out to do 100 miles, and I sat back and I thought about, you know, all the training I put into it and all the veterans that were helping here at BRAVE, and I don't know, something just clicked in me and I was like, it's gonna get done by any means necessary. And I started to understand what a lot of the patients at the BRAVE clinic may have felt as well.
This event was not an event. It was 2 medical students with a crazy idea who had rotated through this clinic that said, hey, like, we need to highlight and show the amazing work that they're doing here, because there is nothing like this within the rest of the country that's being done.
We've had as young as 18 years old and just joined the Guard or the Reserve and, you know, got through their basic training, and they already are having some of those invisible wounds of service, all the way to people who are in their 70s, struggling with very similar issues. So the type of vet that we see runs the whole spectrum. We also see a lot of first responders, law enforcement, firefighters, EMS. You've got the sacrifice, you've got the suck it up, you've got the push through the pain.
We tend to just hide our struggles, and we have all these invisible wounds. But if you just show up and you push through that pain and you're willing to seek help and be vulnerable, that's kind of what this run meant for me.
If you took the kind of treatment that we're giving here and just the number of appointments with those clinicians, it would take over 2 years to try and get it anywhere else. And we're doing it in a 3-day evaluation and a 3-week intensive outpatient program.
You watch the the individual come on day 1 and you watch them leave, week 3, week 4, you see a huge change. And I learned a lot of really cool things that I'm going to be able to implement in my clinical practice in a short period of time here.
Donor support is essential because we're really trying to address all of the barriers to care. So destigmatization, normalization, but also logistic barriers. We bring people in from around the country, and that means that we actually cover their airfare or their travel. We cover their meals because expense and logistics are 2 big barriers to care as well.
It doesn't take much, but a little adds up, and a little and a little and a little adds up. And so whatever helps and whatever they're willing to contribute is very appreciated.